Hey, welcome back to our table talk. One of the health topics that we wanted to go over was how often should a patient get adjusted? And that really depends on your history. If you've had accidents, if you've had slip, spills, falls, motor vehicle accidents, traumas, all of those do factor into how often you should get adjusted because obviously injured joints typically will tend to be the areas of concern quicker rather than later. So those are the ones that need to be managed throughout a lifetime. Another thing that will determine whether how often you should get adjusted is what kind of work do you do? What do you do for a living? You might be the person that's go, go, go all the time on your feet, and that's going to wear and tear your spine a little bit differently than somebody who might be sitting all day long. But either which way, it does wear and tear your spine, even if you're sitting all day long as well. And so it will kind of depend on what you do for a living and how much you use your body, right? And this is a really good example. If you drive to LA all the time, how often do you need to change your oil? If you're driving it to LA all the time, you got to change it more so than the guy that's driving it here locally. So it's important to understand that depending on what you're doing to your body and how much you need is going to really depend on your body type and your history. So the average patient probably comes into my office probably about 1 to 2 times a month. Uh, that's usually pretty good for just general overall health and well-being. Whereas, some patients that are a little bit more active come in maybe 2 to 4 times a month. I personally need about once a week, but I keep up with all my patients. I do have history of traumas in my history as well, and I like to do stuff, sporting type stuff. So in order to keep my body at its tip-top shape, I need to get adjusted about once a week. I get massage, and I stretch, and I do exercise. So all those things are very important to maintain your health over a lifetime. All right. So hopefully that answers the question. Keep following us. We'll take care. Bye bye.